Good morning. Thank you. It is Monday, April 7th. Happy Sine Die. This is Public Health and Minority Health Disparities Subcommittee. We have one bill for discussion today. It is Senate Bill 447. This is the Hospital Emergency Pregnancy Related Medical Conditions. As you will recall, we held this bill pending some questions. We wanted to give our members time to work through some concerns with the Attorney General's office. I think we have I think we have some update. Delegate Alston, did
I just want to, oh, sorry. All of my questions have been answered. Thank you so much for holding it so that I could get the information I needed. Thank you.
All right, thank you very much, Delegate Alston. So I want to go ahead and open up to discussion. Let me start. Let me start with Aaron. If you can walk us through the bill once again, and it was amended in the Senate, so we have no amendments on the House that we are considering. Am I correct on that?
Correct. There's no amendments in the House. We walked through the bill at the last subcommittee meeting. The bill requires that if a hospital determines that a patient has an emergency pregnancy-related medical condition, the hospital must, using the staff and facilities available to the hospital, provide further examination and the treatment required to stabilize the emergency pregnancy-related medical condition, including the termination of a pregnancy when the termination is medically necessary to stabilize the patient, or transfer the patient to another medical facility. A hospital shall allow the termination of a pregnancy at the hospital if the patient's treating healthcare practitioner determines termination is medically necessary to stabilize the patient. There's also provisions in the bill that provide that a hospital may not penalize or take any other adverse action, including an action related to discharge, promotion, demotion, suspension, compensation, training opportunities, staff privileges, or admitting privileges against a treating healthcare provider if the provider refuses to authorize the transfer of a patient with an emergency pregnancy-related medical condition that has not been stabilized. There are penalty provisions in the bill that would subject a hospital to a state fine. But if the hospital is subject to a federal fine, that state fine could be stayed pending the federal fine. So some of the reasons for that amendment was to just make sure the hospitals weren't penalized twice. And then there's a conscience clause provision stating that just for hospitals, stating that except as provided in the bill, that there would be an exception to the conscience clause for hospitals who comply with the bill, but there's no effect on the conscience clause for providers.
Okay, thank you, Aaron. And there was no House cross file for this bill. So we are just working off the Senate bill. I have a question from Delegate Chisholm.
Aaron, can you tell me where the difference is between EMTALA and this bill now? Is there anything glaringly different? Is it the same and we're just putting this in as an extra layer of protection?
This bill is only related to the treatment of emergency pregnancy-related medical conditions, whereas EMTALA is more broad.
Yeah, EMTALA says you got to treat them no matter what. I understand that part of it. But as far as it applies to emergency pregnancy, is it this? Would EMTALA cover everything that's in this bill now?
I do not know the answer to that question.
And
there are more expert people in EMTALA on here.
I see I have a hand from Robin Elliott. Oh, and actually we have a hand from the sponsor of the bill as well.
I can defer to Robin if she'd like to go.
Good morning. Good morning. Happy Sine Die, everyone. Thank you for that question. The main difference is really two, and that is, as Council said, it's the scope of the bill. The second difference is that it would allow, unlike the federal law, it would allow the state to enforce this law. So it gives the state the ability to have this requirement and make sure that it is complied with.
So instead of a federal prosecutor, it would be the AG's office.
Yes, and it's under the Health General, so I would imagine the Secretary of Health would also be involved.
Okay. So when you say scope, you're just referring to it's more narrowly focused than EMTALA when you say scope. Am I correct on that?
Yes, yes, Delegate.
Okay. Thank you, Robin.
Thank you, Delegate. Delegate Riley.
Thank you, Madam Chair. I appreciate that. Yeah, as I was looking through everything, so it looks like there was quite a bit of opposition from many of our hospitals. I don't think that the amendments fixed any of that, and because this was the same bill that the Senate had voted on. So I was just wondering, you know, we've had this on our calendar for several weeks now or several days. Would it be possible if we could hold this bill for further discussion, like maybe during the interim and bring it back? I think this is a big issue that, you know, we need to work through a little bit more.
So just for our folks that are watching the live stream, we do have a policy within our committee that if a member wants to hold a bill for further consideration, that they do have one hold. And Delegate Riley, am I correct? You have not held a bill this session.
I have not.
Is that correct? So I think it's a reasonable request. Let me go to Delegate Hutchinson, and then Delegate Riley, we'll address your request to hold the bill.
Thank you, Madam Chair. I appreciate it.
Absolutely.
Thank you, Madam Chair. I just wanted to echo that I support Delegate Riley's ask to hold the bill.
Okay, so we've had 2 requests to hold the bill. I do see a hand from Delegate Lamb's office, the sponsor of the bill. So let me go to Delegate Lamb.
Thank you, Chair Bagnall. I was just going to address
Senator Lamb, sorry.
No worries. I was just going to address Delegate Riley's initial question about the hospital objections. There was hospital objections at the Senate hearing, but we've worked all those out, and I believe the hospitals have sent a letter to the committee expressing that they are now neutral on the bill.
And Delegate Riley, does that satisfy your concerns, or would you like more time?
Yeah, I don't have that letter, and neutral is not support to me, so I would like a little bit more time, and I still would like to hold the bill. Thank you.
Okay, thank you, Delegate Riley. Let me go to Delegate Hill.
I just wanted to, we're at the last end, so we're holding it on this last day. We just wanted to make sure that that's the plan.
I do appreciate that. And I'm aware of the calendar.
Okay, all right, all right.
Absolutely. Thank you, Delegate Hill. And I wish we had a cross file, so we had been able to consider this earlier. But I do want to respect our members and the procedures of our committee. So I'm going to go ahead and hold this bill for further review. Watch your emails. You know, a lot happens on Sine Die. A lot can happen. So just make sure that you are staying flexible, and we will look further at this bill and see what we can do. But I really appreciate you all making yourself available and doing the work and staying flexible. So thank you very much. Watch this space. With that, I'm going to go ahead and adjourn our subcommittee. And I will see you all